It is a great honor and a privilege to welcome you all to the first and historic African Pan-African Association of Surgeons International at this international conference in the kingdom of the Pan-Africanism African Union Commission. African countries would not develop economically and socially without substantial improvements in healthcare delivery and of citation. Global surgery can play an important role in improving the health of individuals and economic productivity of African countries. Global surgery, a tool for economic growth in Africa. Global surgery, one of the tools against poverty in Africa. Indeed, poverty is a disastrous situation in Africa. It should disappear totally from our environment. I remember the past Secretary General of the United Nations, His Excellency Kofi Annan. He said, the highest enemy of health in the developing country is poverty and obstetrics. Yes, we as surgeons, stakeholders, should be engaged for this purpose. At the end of this conference, I hope a roadmap, an action plan will be proposed to health policymakers for an adequate global surgery implementation in Africa.
Pan-African Association of Surgeons meeting with the African Union Commission. Now, this is the first time that the Pan-African Association of Surgeons, which is an association that covers the whole region of Africa, meaning the subgroups of the sub-regions like the COSEXA, which is the College of Surgeons of East Central and Southern Africa, and the West African College, and the ones in Central Africa, all come together under the Pan-African College of Surgeons. And we were meeting the African Union and having this meeting here at the African Union headquarters because the issues of essential and emergency and essential surgery are issues that are embedded in the SDGs according to the resolutions that the member states have passed at the World Health Assembly and also at the UN through the SDGs. Now, we know that the African Union has recently started taking on responsibilities and playing a big role in health. Now, as you know, there's already the setup of the African CDC that was just launched. So for us as surgeons in Africa, we are interested to ensure that as we prepare our health systems, strengthening them and preparing for the primary health care and universal health coverage, that all aspects of healthcare are taken into account. And as you know, surgical services are very, very important, especially if they are provided close to the people, which is at the district hospital level. So this is the narrative and the discussion that we've been having here. And the meeting, the goal of the meeting is to discuss these things so that we are all at the same page together with the African Union, and then to work out ways in which we can work together towards achieving universal health coverage for our people across the whole continent of Africa. This meeting also presented an opportunity for sharing of best practices because many countries are already moving on this work through preparation of their national surgical plans. Ethiopia is a great example that has shared with us what they have done so far and what they are doing, and of course the challenges they have faced so that other countries that are starting up cannot face this challenge. And from this meeting at the end, we should have a roadmap on how we can work with the African Union and all the stakeholders that are present. Everybody has been represented here. The South Africans are here, the whole COSEXA is here, the West Africans are here. So the whole team of African surgeons and anesthetists and nurses are here to have this meeting. And we want, at the end of this meeting, to work out a roadmap on how we're going to support the African Union and also work with the African Union using that platform to ensure that this thing gets to the people and we can deliver good services to our people on the continent. So that's what the meeting is about. I myself am Emmanuel Makasa. I come from Zambia. I'm a health diplomat and I'm a surgeon myself, but I work for Zambia at the United Nations in Geneva, and I deal with health. I am the one who was behind the adopting and negotiating the resolution on essential and emergency surgical care and anesthesia. So I have a lot of personal interest in this work and also professional interest, and I have a key role to play in this meeting and many, many meetings that address global health, at least for the continent of Africa.
It gives me very great pleasure to see African surgeons and anesthetists taking leadership and setting the policy and the political agenda for the universal access to global surgery. But over the past 2 decades, significant strides have been made in global health, leading to a remarkable reduction in death and disability. However, significant changes remain that include inadequate investments in health systems, integration of services, and hospital-based care. It is also equally important that we move towards ensuring that global surgery is prioritized in our health systems. Universal access to surgery is an indispensable part of a functional health system at any given time.
What is the state of health investment in Africa today? Unfortunately, the picture is not promising. There are 3 doctors per 10,000 people on average, 1 pharmacist per 10,000 people. This should be contrasted with a world average of 30 doctors per 10,000 people. I'm sure the situation is not any better for surgeons and other specialists needed in our hospitals and health posts, and especially in the rural areas. Simple put, Africa does not have enough surgeons, oncologists, pathologists, epidemiologists, and other essential health workers that are needed to provide decent health care to its citizens.
I'm here to discuss surgery, which cuts across all the disciplines and creates a lot of morbidity and mortality for our populations. As I talk, 1 female dies every hour of pregnancy-related complications in this world. And we see that surgery affects children when they are born and adults when they have cataracts. And in between, all the disciplines in medicine are affected in one way or not by surgery. Trauma, for example, causes more deaths than HIV, TB, and malaria combined together. I am here to push the African Union Commission to try and advocate to the governments and help us get solutions for the problems. We know the problems, the solutions are there, and we can sort this problem out. COSEXA has trained roughly 205 surgeons to date, and there are 400 trainees training in surgeons at the present moment. This is a non-metropolitan model of training surgeons, which results in surgeons working in non-metropolitan areas. And my request is for governments to assist COSEXA scale up the training programs so that by 2030, we can have each district hospital manned by surgeons who can provide emergency and essential surgical care that is desperately needed. Thank you very much.
Well, it's great to be here this week. This is the first time I've been to a PAS meeting, and the great thing also is that you meet so many like-minded colleagues who have a real interest in surgery in Africa. We've covered a number of subjects right across the board, and it's really interesting that there's a certain amount of unanimity between many people in the Congress. This is a very important time for us, and this is an ideal place, the Africa Union building, to discuss these matters. And we're very hopeful that the Africa Union can in fact aid us in disseminating the views we have concerning surgery at the first level referral hospital. The most important thing is to identify exactly what we require for surgery and anesthesia in rural hospitals. Once we've done that, we need to collect data, and we need to write a surgical care plan, national surgical plan. And if this is successful, then we can begin to make a difference. And this may be the last chance we've got, in the sense that the World Health Assembly resolution only really is successful in 20% of cases. And we don't want our resolution on building essential and emergency surgery as part of universal health coverage to be a failure. If that were to happen, we've lost it. So it's really dependent on every single one of us to take our own interests forwards. Not to tell ministries of health what to do, but to assist, help, advise, recommend, maybe even put some money towards pump priming facilities to get one aspect going. I'm not talking about large sums of money, but small sums of money which could lead to success. So I think this meeting has been extremely good in getting us together, and we should have more of them. A lot has happened in the recent year or two. The Lancet Commission identified the crises. The G4 Alliance has got the incentives and the advocacy to really get the ball rolling. And there are many other organizations too. So this really is the time to move.
It has been an absolute privilege to be part of the GSI Africa meeting. The importance of global surgery, what it will do to particularly the underprivileged populations in all of Africa, and the potential it has to achieve that is really outstanding. This has been a remarkable accumulation of individuals from across Africa, all with the similar goal in mind, and where the real success has been is that this is kind of uniting the group of surgeons and other surgical disciplines and anaesthetists into a local African solution for the delivery of effective surgical care. One of the things that is always forgotten is that, in fact, the highest incidence of, or the greatest burden of disease from a surgical perspective is going to be in these very underprivileged communities, and getting that fixed is going to have massive effect, both in terms of the quality of life for Africans, but also to the economies. And it is particularly in the latter that we will need to find the leverage to persuade the decision makers across the African continent to establish and to look at some of the programs that we're thinking about. So the way forward here, and there's been a lot of guidance that we've been given by a number of people here at the African Union, is to develop in the first instance, a plan to promote the concept of global surgery, and then to take that in time, hopefully, into some of the significant programs within the African Union, so that they become embedded within the political will of the countries in Africa. Clearly, this is a long process, but we are all very passionate about the importance of this and believe that we have the information to get much of this program getting the leverage that it requires.